From asthma to bronchitis, how to tell what's behind breathing issues. Breathing is something we often take for granted until it becomes difficult. For many people, symptoms like tightness in the chest, constant coughing, or feeling short of breath can be alarming. But what's really causing these problems? Is it asthma, bronchitis, or something else? In this video, we'll break down the symptoms, causes, and treatments of asthma and bronchitis to help you understand what might be behind your breathing troubles. And if you're new here, don't forget to subscribe to Earthluxe for more health insights that can improve your well-being. Understanding breathing problems. Breathing issues can range from mild breathlessness to feeling like you're truly gasping for air. These symptoms can come from various conditions or factors, from allergies to viral infections to chronic illnesses. Among the most common causes are asthma and bronchitis. While these two conditions have some overlapping symptoms, they stem from different issues in the respiratory system. Figuring out the cause is the first step to effective treatment. What is asthma? Asthma is a chronic respiratory condition that causes the airways in the lungs to swell and narrow, making it difficult to breathe. This can lead to symptoms like wheezing, chest tightness, coughing, and shortness of breath. Asthma symptoms can come and go, and they're often triggered by specific things such as allergens, exercise, cold weather, or even strong emotions. Asthma can develop at any age, but it often starts in childhood. Some people with asthma experience symptoms occasionally, while others struggle with symptoms daily. Since asthma is a chronic condition, it requires long-term management, usually with the help of medications and lifestyle adjustments. Symptoms of asthma. Asthma has certain hallmark symptoms that make it somewhat easier to identify. These include wheezing, a whistling or hissing sound when breathing out, which is especially common during an asthma attack. Coughing. This is often a dry cough, especially at night or in the early morning. Shortness of breath. A sensation of not being able to get enough air, which may worsen during physical activity. Chest tightness. A feeling like something is squeezing or pressing on your chest. Recognizing these symptoms can help you determine if asthma is the cause of your breathing problems. What is bronchitis? Bronchitis is an inflammation of the bronchial tubes, the air passages that lead into the lungs. Unlike asthma, which is often linked to allergies, bronchitis can be caused by viral infections or prolonged exposure to irritants like smoke. There are two main types of bronchitis: acute and chronic. Acute bronchitis. This usually develops after a cold or respiratory infection and lasts a few weeks. Acute bronchitis is more common and is often temporary. Chronic bronchitis. This is a long-term condition, often linked to smoking, and is one of the diseases within chronic obstructive pulmonary disease, COPD. Chronic bronchitis can persist for months or even years and leads to ongoing damage in the lungs if untreated. Symptoms of bronchitis. Symptoms can overlap with asthma, but there are some distinct signs to look out for. Persistent cough. A productive cough that brings up mucus and can last for weeks, especially with acute bronchitis. Chest discomfort. A heavy, tight, or uncomfortable feeling in the chest. Fatigue. This can occur due to the ongoing effort of coughing and difficulty breathing. Shortness of breath. Especially noticeable during physical activity, although it's generally less intense than in asthma. Understanding these symptoms can help distinguish bronchitis from asthma and other respiratory conditions. Comparing asthma and bronchitis. While asthma and bronchitis can share some symptoms, they have key differences. Cause. Asthma is often linked to allergies or genetic factors, whereas bronchitis can be triggered by infections or irritants. Duration. Asthma is typically a long-term condition requiring ongoing management. Acute bronchitis, however, usually lasts a few weeks, while chronic bronchitis persists. Mucus production. Bronchitis usually involves a wet cough with mucus, while asthma coughs are generally dry. Triggers. Asthma is often triggered by allergens, physical exertion, or even emotional stress, while bronchitis is usually brought on by infections or exposure to irritants. Diagnosing asthma and bronchitis. If you're dealing with unexplained breathing issues, a healthcare provider can perform tests to figure out the cause. Diagnosis for asthma and bronchitis often involves a physical examination and additional tests, including spirometry. This test measures how much air you can breathe out and how quickly. It's a common test for diagnosing asthma and chronic bronchitis. Chest X-ray. This can help rule out infections or other lung issues and is often used to confirm or rule out bronchitis. Blood tests. These can detect infections, which may indicate acute bronchitis. Allergy testing. This is often performed if asthma is suspected, as it can identify specific allergens that may be triggering symptoms. Seeing a healthcare provider for a diagnosis is essential to avoid incorrect self-diagnosis and ineffective treatment. Treatment options for asthma. Asthma treatment focuses on controlling symptoms with medication and lifestyle changes. People with asthma may use a combination of daily medications and rescue inhalers for sudden symptoms. Common asthma treatments include inhalers. These provide fast relief by delivering medication directly to the lungs, helping to open the airways during an asthma attack. Long-term control medication. Some people need daily medications to reduce inflammation and prevent asthma flare-ups. Lifestyle adjustments. Avoiding known triggers like allergens, smoke, and cold air can prevent asthma symptoms from worsening. Treatment options for bronchitis. Treatment for bronchitis depends on whether it's acute or chronic. For acute bronchitis, rest, hydration, and avoiding irritants are often sufficient. Chronic bronchitis, however, requires ongoing management. Treatment options include cough suppressants. These can help reduce coughing that disrupts sleep. Bronchodilators. These medications relax the airways, making it easier to breathe. Antibiotics. These may be prescribed if there's a bacterial infection causing bronchitis. Lifestyle changes. For chronic bronchitis, quitting smoking and avoiding air pollutants are essential to prevent further lung damage. When asthma and bronchitis overlap. Sometimes, asthma and bronchitis can overlap in a condition known as asthmatic bronchitis. This can occur when someone with asthma develops bronchitis due to an infection or exposure to irritants. The combined inflammation from both conditions can lead to more severe symptoms, making breathing even more challenging. Treating asthmatic bronchitis involves addressing both the asthma and the bronchial irritation from bronchitis, often requiring a combination of asthma medications and rest. When to seek medical attention. If you experience breathing problems, knowing when to seek help is essential. Here are some signs it's time to see a doctor. Your symptoms are worsening or don't improve with regular treatments. You're struggling to breathe or can't seem to catch your breath. You experience chest pain or severe fatigue that doesn't go away. Early medical intervention can prevent complications and allow you to get the correct treatment before symptoms escalate. Tips for managing breathing issues at home. If you're living with asthma or bronchitis, these tips can help you manage your symptoms and improve your quality of life. Avoid smoking and pollutants. Smoking can worsen both asthma and bronchitis. Avoiding secondhand smoke and polluted environments can help. Stay active, but don't overdo it. Regular exercise can strengthen your lungs, but be mindful not to push yourself too hard. Eat a healthy diet. A balanced diet supports your immune system, which can help your body manage inflammation better. Natural herbs can make a valuable contribution to relieving breathing problems and coughing. Dandelion is known for its anti-inflammatory properties and can help relieve irritation in the respiratory tract. Nettle is a powerful herb that supports the immune system and can help reduce mucus production, providing relief from coughing symptoms. Sage, with its antimicrobial properties, can soothe the throat and reduce coughing. There are also several cough syrup recipes that you can make at home. For example, a syrup of honey and sage, which is known for its soothing effect on sore throats and coughs. Another option is a mixture of dandelion root and honey, which can help promote healthy breathing. These natural remedies are easy to make and can be a gentle yet effective way to relieve respiratory symptoms. Monitor air quality. On days when air quality is poor, try to stay indoors and avoid outdoor activities that may worsen breathing issues. Additional lifestyle changes. Managing respiratory issues involves more than just medications. Making the right lifestyle changes can help reduce symptoms and make breathing easier. Use a humidifier. This can help keep your airways moist and prevent irritation, especially in dry or cold climates. Practice breathing exercises. Techniques like deep breathing or pursed lip breathing can help strengthen your lungs and improve oxygen flow. Reduce stress. High stress levels can worsen asthma symptoms. Try activities like meditation, yoga, or even a relaxing hobby to reduce stress. Understanding the differences between asthma and bronchitis is a crucial step in managing your health and finding relief. Breathing issues can be challenging, but with the right information, you can take control. If you found this video helpful, please subscribe to Earthluxe for more tips on health and wellness that can help you live a better life. Join our community as we explore more ways to support your well-being. Thanks for watching, and we'll see you in the next video.